Hi, I'm Dr. Gulati. So clearly IVF is not the only option for pregnancy. I think we always need to do an evaluation first. We need to assess where we're coming from. And in some cases IVF is the right technique, in some cases clearly not the right technique. Sometimes we can use oral medications, we can use injectable treatments. And in some cases, we want to think about preservation for the future. And so egg freezing is something that we do all the time now. Fertility preservation is one of the new things in our field, and I think we're seeing it more and more each and every day. Young girls are even coming and saying, should I preserve my fertility at the age of, the mid-20s and into the early 30s? And I think this is one of the unique times where we really can help women for the future. And I think it's an important thing to really consider at a young age. Many people in today's world are really delaying fertility, and by actually freezing your eggs for the future, we preserve that. So when we talk about an academically based program, I think the importance of it and where our patients really gain from is that, we do everything evidence-based. We don't just say, well, this seems like a good new thing to do. We make sure we review the literature. We look into everything. We look at our previous successes. We look at what our patients have done before so that we can make very constructive advances and constructive changes really in our practice. Having my kids was probably the best thing in my life. And I remember during my fellowship, after I had been helping so many people, to actually have my own daughter my first daughter was remarkable. And then after you have your first child, you say, do I have more love to give? And the answer is yes.